So, welcome to the Pursuit of Truth. I will put the slide so you can see what I'm looking at. So, this is in regards to some slides Chris Whitty was talking about on the Prime Minister's briefing. I think it was yesterday. Does that the date? It was up to the 4th of January, and the figures are. So, one thing I don't like is the use of the estimated number of people testing positive for COVID-19 in the community in England. I don't know why they need to use an estimate when surely they have the actual figures. Why are they using estimates? Because it depends how good you are at estimation. Then, I mean, that seems like a pointless thing to be doing when you actually do have the actual data. But I guess they're trying to suggest that people aren't or don't know, because I guess that's why they're doing that. But the one I really want to talk about is this unadjusted rates of COVID-19 hospitalisation for vaccinated and unvaccinated people in England. Cases presenting to emergency care within 28 days of a positive test resulting in overnight inpatient admission by specimen date between 22nd November 21 and 19th December 21. It just has unvaccinated and vaccinated with 2 doses. So what I wanted to know with this is, what are they doing with people with just one vaccination or a booster? Are they putting them as unvaccinated, or they're just not including them in this graph? Is it just merely those 2? And with unvaccinated, are they including people who are unable to be vaccinated because of medical conditions? People who maybe can't give consent because they're sick in hospital, in ICU or whatever, or people who are not eligible for it. It's the under 12s, I don't know, between 12 and 15, 12 and 18, which ones people have been given 2 vaccinations. I think there's only 1, so for people under 18, isn't it? So strange, it does have a little bit of under 18 with, well, it's on the 0 line, so I don't know. Yeah, so what is that unvaccinated? Because they often put it across, maybe not scientists, but definitely the government officials and media, because this whole argument of the vaccinated people clogging up the hospitals, by suggesting that all these unvaccinated people are just because they don't want to do it because they're anti-vaxxers or something, whereas it may be because some of them unable to give their consent, some of them because they're sick, some of them maybe because they're unable to get it because of a medical condition that's stopping them getting it. I don't know how much percentage of people have stopped getting vaccinated because of medical conditions. They have a previously bad experience with them, or they're allergic, or old age prevents them from getting it. So I don't know. So then, but what worried me is, because there's lots of caveats, is also how they get these figures. But why do they always have to do it rate per 100? I don't really understand that, because I know they're trying to extrapolate it to make it, well, makes it seem more than it is, but because it may just be 3 and 5 people, and then, well, that, but I think I did actually find the raw data in this, because it's got the source for the UK Health and Security Agency, week 51, and it shows here, and it explains a lot more than they actually tell you of how they collect the figures, what they include and what they don't include, and all that kind of stuff. Because my worries with statistics is the famous maxim, lies, damn lies, and statistics. And I know that, you can manipulate them. So I found this bit on vaccination status and case, deaths and hospitalisation. Goes through the methods and how they do it and all that, and NIMS and all that kind of stuff. And denominators, etc. But it's got here COVID-19 cases. Where is it? Table 9. COVID-19 case presented to emergency care within 28 days of a positive specimen resulting in an overnight inpatient admission by vaccination status between week 47 and week 50, 2021. I don't know if this is the same as that graph that they're using, but they use this as the source information for that graph. Here it shows for 80-year-olds on Chris Whitty's slide, it shows unvaccinated. There's a big blue line up to 200, over 200. per 100,000 and vaccinated with 2 doses under 50. But when you look at the actual raw data here, it says there's a total of 1,222 80-year-olds that presented themselves to emergency care and had to stay in overnight. We're assuming because of COVID. We don't know because it doesn't actually say if that was the primary reason. It says here 261 of them were not vaccinated, but it says 931 of them had a second dose plus 14 days before specimen date. So if that's the data, I don't understand, because the data there says non-vaccinated 261, vaccinated 2 doses 931. So they're saying that 931 people who were vaccinated over 80 presented themselves to emergency care. There's only 261 non-vaccinated came. So that would suggest that actually 2-dose people were more presenting themselves to emergency care. But on Chris Whitty's, it's the other way around. Has he mixed up the colours there or something? I don't get it. Is that because they've done this rate per 100 and that's created a different picture than the actual raw data? And they like to say here, like, raw data should not be used to assess vaccine effectiveness, and the reason for that is because if you look at deaths, it's not unvaccinated people. Let's say that they're right, that more vaccinated people go to hospital, which I can't see it in the raw data, but in theirs. And there is another table lower down, which is maybe where they're getting it from, unless it's a different week or something. Because this one is, I think, the one they're using. Cases reported by specimen date between week 47 and 50, case percentage emergency. But because here it shows per 100 unadjusted rates, which is what I mentioned on Chris Whitty's one. This seems to be saying the same thing. Case presenting emergency care within 20 days results in overnight inpatient stay between week 47 and week 50. It says unadjusted vaccinate, not vaccinated, 207.8, where it says with 2 vaccines, 34.9. For this is the 80-year-olds. I'm just picking that one because it's easier to say it. So I don't understand, because on the raw data, it seems to suggest 2 doses. There was 931 people going to being admitted to hospital for at least a day, having tested positive for COVID. Whereas here it says it's 34.9. which is lower than the unvaccinated, was 207.8. So I don't understand. It seems like the actual opposite here. So I don't know, is that because they do this per 100 that it creates, well, it's not actually creating the, I don't know, they don't, to me, they don't make sense. And the first one makes more sense because it matches the deaths. When you look at table 10, COVID deaths within 28 days, and it says also within 60 days. With positive specimen of COVID reported death certificate for vaccination status, it shows 80-year-olds, total 1,350, 13 are unlinked, so they couldn't find them on their national insurance number. 241 of them were not vaccinated that died out of that 1,350. 1,055 had 2 doses. So there it's clearly showing that less non-vaccinated people died, more vaccinated people died. Obviously, that should be the case because there are more vaccinated people than non-vaccinated people by percentage, so you would expect that number to be higher. And that doesn't necessarily mean that the vaccine isn't working. There's always going to be, this vaccine is not 100%. And of course, as I've often argued, can we really say that the vaccine does actually work, in the sense that if you had a bad immune system or you have other medical conditions that cause a problem, then no amount of vaccination is going to stop that? I don't think. That's the thing, I don't know. Like, it's a bit like, a crime in the future. If you were to be able to stop it and then you can't prove that, well, that wouldn't have happened because you stopped it. So I don't know if, for instance, I may have a perfectly good immune system. If I caught COVID, nothing would happen to me. So giving me the vaccine doesn't actually make any difference. So I don't, but let's just say that their vaccine does work. But here you can see that more people vaccinated are dying than non-vaccinated. So the thing I'm trying to get at is this whole argument that the media is putting across about, vaccinated people clogging up the hospitals. I think Prime Minister said 90%, whereas I know that, was it the Daily Mail, one of them was questioning that figure, whether it's actually 35%. But yeah, I just don't get the discrepancy between Chris Whitty's slide and even the slide in this one, where it seems just there's non-vaccinated people that are more in hospital, but the raw data, not the rates one, seems just the other way around. And see, that's where it's very easy if you then pick whichever table you want to show. It's interesting they're not showing the deaths, which show that vaccinated people are dying more than non-vax people. Why is that? Because that doesn't buy into their argument of get vaccinated. So yeah, it was just interesting that I found that, and just thought if there's anyone out there, maybe they can explain it, why I'm seeing this discrepancy. Maybe I'm not seeing something. Yeah, take care, take it easy, God bless, and peace.